In the room, please, you have the opportunity to use the standing audio system here. If you could just introduce yourselves when you take the floor and in the conversations. For those online, usual protocol applies through Zoom, and we'll be looking to ensure that we bring people into that and the Slido conversation. Do use the chat function. We'll be making sure that that's monitored and brought to our attention as well. So Maria, please then, if we can put up Maria's presentation, and we'll go to the first item in terms of the overview.
Thank you. Thank you very much, Jean. And once again, what a privilege to have so important people, association groups and professionals connected today and decided to align. Just a quick presentation to maybe set the scene a little bit, recollect what we have been doing in the past and telling you what are the plans for the future. And of course, using this to collect your suggestions and the work that you are already doing and making sure we are all moving in the same and driving the public health agenda in the same direction. Those are beautiful lungs, as you can see, but those are the lungs and the air that is at risk. The next one, please. And of course, this presentation will be available. If I can have, voila. I'm sure that I don't need to go through many of the things that I will present here today, but definitely the temperatures are increasing and it's our fault. I think it's a very good summary to start the discussions. It is caused by human activity, and therefore there is through human activity that we need to solve this problem. We are facing a very challenging situation, as you know, and this is why we need to go to the COPs and negotiate and remind the negotiators they are not just dealing and negotiating about the centigrade degrees, the Celsius degrees, but they are negotiating as well with our health. Let me have the next one, please. Of course, the warming is changing depending on which part of the world you are, but you can see that the pattern is very consistent. So whether you are in Fiji or in Australia or in Switzerland, you will see that the pattern is very consistent and we are all going to the very important global warming. Next one, please. But it's not just the temperature. I think we all saw what an extreme weather event can represent. I think those who are from Canada will very much have vivid images of what the wildfires represented for them. We have, again, sea level rising. We have the destruction by floods. We have plenty of natural disasters, and no country is protected, as you can see, from Canada to India, Libya, and those are just the 3 examples of the many. You take any newspaper every day and you will see in the headlines that there is something related directly or indirectly with the global warming. Next one, please. If we look at the World Economic Forum and how they define what are the global risks, you will see that in 2018, climate action failure was considered number 5, which was already very high in the ranking, but extreme weather, major natural disasters, severe attacks, data fraud, and climate action failure were the risk that for the World Economic Forum were considered as the most important. But if you look at 2022, you will see that climate action failure, it comes to the position number 1, followed by extreme weather events, biodiversity loss, social coherence, and livelihood crisis. And this is where the people looking at the financial situation, the economic situation are concerned about. So as you can see, there's this reaching already the economic agendas, which is maybe something that will allow us to accelerate this major what is a major public health issue as well. Next one, please. The extent to which current and future generations will experience a hotter and different world will depend very much on the choices we are taking now. That's why we need to look at the emission scenarios and making sure that all together we can change that. Otherwise, in 2060, almost all our population will be exposed to very high temperatures and very major problems if we don't address now the causes of climate change. Next one, please. The health effects are very diverse and very large. And we can move from, as we say before, those extreme weather events, disasters, natural disasters, but we have been facing as well the heat waves, and even 38 Celsius degrees, it can be a major problem for certain countries that are not prepared at all for this type of temperatures. And you all saw what's happening in New Delhi 1 week ago. Of course, our mosquitoes and other vectors will find perfect conditions to transmit diseases like malaria or dengue. And one of the major concerns is access to safe food and food for feeding our population, which might be as a consequence of all of those natural disasters, it can be very much at risk. So the panorama is really very, very dramatic. And in addition to that, yes, the next one, we are facing emerging issues like mental health. More and more data tells us that 45% of our young people, they are saying that climate change has a negative impact on their daily functioning because they are less concentrated, or they have difficulties to work, or they are stressed at the school, and they reduce the time spent in nature, the playing, having fun. Relationship is all very much affected as well by this global warming. Next one, please. For WHO, for our Director General, we know that the climate crisis is a health crisis, and Dr. Tedros has been very consistently been repeating this message that we need to make sure that we need a radical action to safeguard the health of the planet, because it depends, our health will depend very much on that. Next one, please. So let's focus on what are the key areas that WHO and the global health community has been focusing until now. One, of course, we need to address what we saw already, the wide range of health impacts of climate change. Number two, we need to make sure that the health systems we have now are climate resilient, the one responding to the challenges that we are facing at the moment. So they need to be climate resilient, environmentally sustainable, and they need to be better prepared to cope with what is coming now. And another one, which is critically important as well, and at the same level, and maybe we need to accelerate even more action on that, is promoting the health benefits of climate change mitigation in other sectors. This is probably the more positive, the most engaging and motivating, and the one that will give us access to what we call the health argument that I will present later on. Next one, please. So what if we go to what we want in terms of health systems, we want a health system which is very performant. Of course, we want to provide the best system to our patients, but we know as well that health system to be resilient, climate resilient, we need to look at carbon footprint, and this graphic will tell you by country where we are. At the moment, the health system climate resilience score is not very positive, as you can see, and we would like to have all on green, and of course in the column where we can have a better overall performance, and at the same time reducing the emissions from the healthcare. Next one. Those are different hospitals around the world. Ideally, we would like to see a system, a healthcare system where we are emitting very low and at the same time being very performant and providing the best services, as I say. But in the middle, you have different options. Of course, if you look at in your left, the performance of a healthcare facility in Africa, for instance, of course, they are not contributing to the carbon footprint, and they still need to gain access to electricity, for instance. That's why we want to solarize those healthcare systems, like the image on the top on your left. With those solar panels, we will be able to at least provide electricity. The image on your right top on the right, it will be a very sophisticated hospital where hopefully we can have a green and perfect performance in terms of care. Next one, please. What do we call a health system that is fit for the 21st century? Well, it will be the one that will have, of course, all of those blocks of what we call climate resilience, the building blocks of the health system. I will not go into detail because I'm sure that you all have this presentation and this guide from WHO. And if not, we will provide it on the chat and you can have access. But at the same time, as the health system, we need to reduce the around 5% of the global carbon emissions that the healthcare is producing every year, including 70% more or less that is coming from our supply chain and procurement. So there is a big challenge and big plan in front of us, but I think we can go for these low carbon health systems that are resilient and hopefully reducing our own carbon footprint. Next one, please. In terms of the second part, where we say addressing the wide range of impact on our health that climate change is having, I think you all know very well the climate sensitive health risks, which are going from injuries and mortality from extreme weather events to heat related illnesses, which are increasing very much, respiratory illnesses, waterborne and vector-borne zoonosis, malnutrition and foodborne diseases, non-communicable diseases. Some people remains a little bit surprised when we tell them that it's very much about non-communicable diseases as well, mental and psychosocial health, and of course, the way our health systems will be impacted and the effects that the climate change will have on health systems. Next one, please. So how do we strengthen key public health functions to protect from climate risk? Very basic interventions, which are very much the non-regrets investments, climate-informed surveillance, capacity building for health workforce, mainstreaming climate change across the health programs, and of course, we need to address as well the climate health funding gap, which at the moment is huge. Because although everybody recognizing all the projects, national determined contributions where health is very prominent, but when we look at the amount of funds allocated to health under climate change impact, the amount of funds are no more than 0.5% of all the climate finance. So I think this is a point that we can, in the discussion, elaborate a little bit more. Next one, please. Emissions needs to decrease to near zero to achieve climate sensibilization. So clearly we need to look at what are the estimates and the historical emissions and look at different scenarios, but here we need to, all of us, do this scenario and then obviously try to reduce it by category. Consistent with 2 Celsius degrees will be the one we are aiming for, but if we go for the one that we are now in that trend, it will be a very high risk for climate future. So we need to aim at this climate stabilization. Next one, please. Air pollution. Why air pollution? Well, for us in WHO and all the health community working on climate change and health, we see very much the overlap between the 2 agendas, air pollution and climate change, because they have common drivers. And you will see it, the global sources of urban ambient, are domestic fuel burning, transport, industry, and other human origin and natural sources. And if you look at the global sources of greenhouse gases emissions, again, buildings, transport, industry, energy generation, and agriculture. So we see that 2/3 of outdoor air pollution, for instance, emissions, are generated by fossil fuel combustion. And I think you all heard our Director General, Dr. Tedros, saying that it's a kind of sabotage. When we keep the combustion of fossil fuels, this is doing a very major damage to our health, and therefore we need to accelerate this transition to clean sources of energy to stop this destruction of our own health and well-being. Next one, please. 90% of the population breathes air which WHO consider unsafe. Of course, the levels of bad toxic air in New Delhi are not the same as in Geneva, but 99% of the population is breathing air that is not respecting those standards that are promoted and endorsed by the World Health Organization. And not to forget that air pollution is killing every year 7 million people globally, which means something terrible, 1 death every 5 seconds, and it represents 1 in 8 of all deaths. And this is something that I hate to make this comparison, but it's fair to say that it's more than HIV/AIDS. Yeah, and those is all combined, how air pollution is affecting our health and killing people every year. And 2/3 of this air pollution is from fossil fuel combustion, which are the same sources of global warming. Next one, please. This is a tool that you can have in WHO under air quality and health in our department, and you can see the level of the pollution in wherever you live. And as you can see, India, Delhi in India, unfortunately, is almost always in a terrible red. And maybe in the case of Sydney, Australia, you are a little bit better, but still you have 4,316 annual deaths from air pollution. And in the case of India, we calculate that it's 795,000, which is absolutely figures that are absolutely unacceptable. Next one, please. I hope you know the story of Ella. This is the girl in London who passed away, unfortunately, 10 years ago with a very bad case of asthma. This girl was resuscitated several times at the hospitals, but after that, she was sent back to her home, which was in a very polluted area of London. And therefore, of course, this was solving the problem and then sending her back to breathe the toxic air that at the end killed her. And she's the one that for the first time ever in her death certificate, after 10 years of a big fight by her mom, Rosamund Kisidebra, now in her death certificate, it says that the cause of death, air pollution. And this is a demonstration that we can use legislation, we can use the law to go as far as needed to protect the health of our people. And nobody, no politician will be able to say, I didn't know that air pollution was killing my population in my city, in my country, in my region. This is absolutely not acceptable. Next one, please. Air pollution is responsible for non-communicable diseases. As you know, air pollution is one of the 5 key risk factors. Maybe we need to focus a little bit more on that because enjoying these 2 communities, I know that some of you present today are working in those communities of NCDs. So we need to make sure that we will not lose any opportunity to join forces and make sure that by tackling the causes of climate change, we are one of the most immediate benefits will be the reduction of air pollution, and therefore we can reduce deaths and morbidity caused by non-communicable diseases and accelerate this agenda and on NCDs, climate change and air pollution. Next one, please. This is what we call the health argument for climate action. This is how we can achieve in the Paris Agreement. It will be probably one of the best, the most powerful public health treaties ever implemented. That WHO joins the global call for fossil fuel non-proliferation treaty, phasing out fossil fuels, accelerating on a just and a quick transition to clean sources of energy, clean renewable sources of energy, because other ways we are suffocating and the combustion of fossil fuels are literally killing us. Next one, please. This is the ranking by country average, and then who is the population that the population trust? What are the communities, the professions that our population will trust? And as you can see, we are on the top of that. Doctors, scientists, teachers, armed force, ordinary men and women, and then I'm afraid politicians are a little bit low on the ranking. So this gives us an extraordinary responsibility and role to vis-a-vis our population on driving these big three transitions that we need: the transition to sustainable food systems, the transition to clean sources of energy, and the transition to healthy urban planning and sustainable transport at the urban level. Next one, please. This is a satisfaction, but it gives us a major responsibility, as I say. So we need our health professionals to be educated on their own practice. They are publishing, but we still don't have enough in our medical school curricula. We do not address enough air pollution or climate change and health issues. And if you look at disease guidelines, we need to make sure that we incorporate much more risk factors like air pollution or the big challenge of climate change and other planetary health issues, including loss of biodiversity as well. Next one, please. There is an open WHO online training course. I'm sure that many of you are already aware of this. It's on air pollution and health. It's an introduction for health workers, and this course will examine the main health impacts of air pollution, including non-communicable disease, which roles we can play, how we can join others. It gives you a certificate of achievement. Is of course free and accessible to everybody, and it takes approximately 4 hours. So very much for dissemination. Until now, we have more than 9,000 enrollees joining, and 1,800 health professionals, students, representatives of ministries of health, but this has to grow on an exponential way. Next one, please. I wanted to raise awareness and inform you about this WHO Global Conference on Air Pollution and Health, the second global conference. It will be celebrated in March next year after the COP29. We will demonstrate in March solutions. Of course, we share evidence and raising awareness, but we will look at interventions and solutions to tackle climate change and to tackle air pollution, and demonstrate how we can, if we are mobilized, if we work on a multi-sectorial collaboration, and if we use the health argument, the health benefits that we can obtain from tackling, mitigating climate change, we can have a very important impact. Next one, please. At the conference, in addition to the conference, we will have the Year of Clean Air Commitments. It's 2024 and beyond. And many of other opportunities where we can raise awareness, we can make commitments, we can be very ambitious on raising air quality, on increasing the quality of the air we breathe, energy and climate and health policy actions, including the high-level day that we will have at our conference in Cartagena de Indias in Colombia, with commitments. But don't forget that before that, we have the launch of the Clean Air Flagship, which is already done, the Climate Change and Health Resolution that was approved a couple of weeks, 1 week ago, Global Air Pollution and Health, the technical advisory group, we will have a big meeting in China to look at the main recommendations from a technical and scientific point of view. The 5th International Day of Clean Air, and of course the G20 health ministers in Brazil, the COP29 in Baku in November, the interagency mechanism for tracking policy commitments and progress, and the high-level commitments at the Global Conference on Air Pollution. All of those might look very boring, conference and all of that, but it's important that the health sector is heavily represented, raising your voice, making the health argument, and telling everyone that I say that climate change is not just an environmental issue or a planetary issue, it's a human health issue, and we have a lot to say as the health professional. We need your leadership and coordination. We will convene, as I say, all of those groups to do more. This should not be a difficult choice. This is how we have the economic benefits, and this is important, the economic benefits on human health from air quality improvement arising from mitigation action on climate change can be of the same order of magnitude of the mitigation cost, and potentially even larger. So no excuses when people will say this will be costly, we need to invest. No, the cumulative scientific evidence is unequivocal, and climate change is a threat to human well-being and planetary health. And if we delay action, we will definitely be responsible for the next generation. The health argument is the solution. The health co-benefits of the mitigation, the mobilization of all of these beautiful people on their bicycles and raising awareness, or what we did in Glasgow, the picture on the left, where we committed to have health commitments and we put it in place attached, and where the health workers were demanding already climate justice. So we need all of this awareness raising, mobilization, and using the health argument. Next one, please. What is your aspiration for the future? Up to you to decide, but I think this is another option, which is definitely very friendly and much more in line of protecting our health, our economy, our well-being, our social networking, and only good benefits, and probably even be happier. Let me just say something about ATTACH. ATTACH is the Alliance for Transformative Action on Climate and Health, and it was formed in Glasgow in the COP26, and we have now 84 countries joining, over 65 partners, 4 areas of work, and this is the platform that will provide motivation, exchange of information. We are learning from each other, and we will make sure that these transformations that we were describing before will take place. We need our health systems to be better equipped, reduce their own carbon footprint, and of course, being environmentally friendly. Low carbon health system is the response for that. So please join ATTACH. If you are not yet aware of that, we can provide you more information. And sign up for climate and health action. We have different tools that you can use as well, and use it to disseminate the information to others. Let me go to the last ones already. Next one, please, which is giving you a big thank for this engagement, for what I think it will be only an exponential growth of all the action we are doing together. And let's keep the conversation. Over to you, Jim, and I hope it was not too long and particularly not too boring for all of you. Thank you.
Thank you, Maria, for that masterclass in the political science and the political rationale, the evidence base for why we need to take action on climate change and health, the compelling evidence, the compelling narrative, and the invitation to all constituencies, the health professions and others, to really engage in this next phase, the calendar of activities that were put up in the next 2 years or so, for where there is opportunity to turn that evidence into action with the political engagement, the mechanisms needed. So thank you very much, Maria. I just want to we're going to quickly have a second just overview from the health workforce team on this. And I also want to thank and give recognition to other colleagues in the organization. Whilst today is convened from the climate team and the workforce team, I also want to recognize Gerard Schmidt, Sohail Saikit, and Reda, who's with us in the room, who lead on the work on essential public health functions and their activities. Are we ready with the slide deck, colleagues? Technology. And to really then bring this back into, from the evidence base that Maria has shared, to really come back into then what we're hoping to achieve, the connections around the partnerships we have here today. Next. So as we all know, the 77th, Maria mentioned, the World Health Assembly finished just a week ago now. The International Labour Organization has their Labour Conference talking about the world of work in which our health and care workers are involved. But we had the debate on the international health regulations, and at the core of which clear consensus on the need to ensure that we have the capacity worldwide to ensure that we're able to mount a public health response. Next. Similar language adopted in the Climate Change and Health Resolution and the Health Emergency Preparedness Resolution against natural hazards and natural disasters. Maria gave several examples of the climate phenomena, the climate crisis that we're seeing worldwide. At the heart of all these resolutions, at the heart of all the discussions member states come to, this need to ensure we've got prevention, promotion at the core of the work. Next. And that's really when we look at the workforce and the response and the opportunities there, to really say, have we got, whether it's universal health coverage, whether it's the essential public health functions, whether it's climate security, whether it's health security, have we got the mechanisms in place to ensure that all the occupations involved in the multidisciplinary teams are educated, employed, and retained to ensure that they've got prevention and promotion at the heart? Next. And part of that really then comes back to looking at, well, how do we ensure the functions of essential public health? And these are common. We have prior resolutions in the World Health Assembly about what are the essential public health functions, just as we have the sort of essential health services. What are these population health priorities? How do we ensure the system is able to deliver those, the institutions, the workers, to come together so that we have both the capability in the institutions and the competencies in the individuals? Next. And if we look at Maria, on the right-hand side of this slide deck here, is the operational framework for climate resilient low carbon health systems. And if you look at that and the blocks that Maria mentioned and come back to the essential public health functions, you'll see the alignment with these. This is public health writ large. Next. And if we take these out of their graphical illustrations and just put them into sort of vertical columns and make the comparison, it's so evident. This is the core part. Whether your priority is service delivery, whether your priority is air pollution, whether your priority is clinical capacity, you start to look at this alignment between the frameworks and they've got the common elements of it. And this is where, again, we need to say, let's make sure that our capacity in the institutions and the competency in our individuals is really coming to alignment and synergy. Next. And when we talk in the broadest terms about the workforce capacity here, we're talking today, and with the invitation today is for the health professions to come together to ensure, because this is where we have a lot of opportunity around the world. The professions are those that are most organized, those licensed, regulated occupational groups through the schools, the associations, and the institutions. But we recognize the contribution of all occupations in the workforce to this. And it's not a singular job title. It is a diverse group of occupations. Yes, there is clinical oversight, clinical governance, clinical leadership, depending on the health system and the model around the world. But we're also looking at those that are actively engaged in social determinants of health, in broader literacy, in opportunities around food, nutrition, housing, poverty, all that have an impact on some of the solutions that we need when we talk about public health and climate change. Next. And there are, as many of you are aware, and we may hear from some of the speakers momentarily, as a result of all this public health emphasis that we've seen in the last 3 to 4 years, the opportunity that COVID-19 was to remind us all about the public health emphasis around the roles of the institutions and the individuals. We start to look at this, the tools that are available, which align this capability of institutions, this competency of individuals to come together. And these are the resources that are available now for all countries and partners to implement and take forward. Next. This deck as well is just to have available for resources for all the participants today. And there's a few challenges here that we say. When we start to talk about the actions that are necessary on public health, climate change and health, air pollution, what the challenge will always be is where's our capacity worldwide? And it comes back to issues of equity. It comes back to issues of financing that Maria mentioned in her slide deck as well. If we want to strengthen the capacity at national levels for some of the key health systems issues, we've got to look at the financing of that capacity. We've got to look at the education of that capacity and the engagement and supervision. So that's the perspective from the broader public health and the health workforce side, linked to the evidence that you've had from Maria in terms of why we need to take action. We're now going to move into some observations from the health professions and their representatives. And it is, we're here, it's 2:15 afternoon Central European time, but we're joined by Emma Rosen-Tepatu, the president of the World Federation of the Public Health Associations. And I believe it's getting close to midnight with Emma in New Zealand. Emma's the current president of the association, but obviously many people will know her for her years of engagement in health promotion, health prevention, looking at ensuring that national systems are capable to deliver some of these things. Emma, if we can invite you to give your remarks on behalf of the World Federation.
Kia ora. Tēnā koutou, tēnā koutou katoa. Tēnei te mihi atu kia koutou, ko tai mai I tēnei pō, tēnei ahiahi. Tēnā koutou. Te mihi tuatahi ki ngā mana whenua o tēnei rohi ko ngā tai ki tāmaki. He mihi anō nei ki ngā huamati ki te whānau Michael Mosley, haere atu rā. He mihi anō nei ki koe Maria, ki a koe Jim. Thank you very much for having me this evening, this afternoon, or this morning, depending on where you are, to talk a little bit about the World Federation of Public Health Associations and where we fit in this picture. I've just introduced myself in my language, Te Reo Māori, from Aotearoa, New Zealand. I've said hello to you from the land of Ngā Tai ki Tamaki, which is the tribe of the area on which I live. I've also acknowledged the passing of Dr. Michael Mosley, which is appropriate for me to do in my culture at the beginning of any speaking engagement, is to acknowledge those people who've gone immediately. And also to you, Maria, it's great to see you again, and Jim, and also to see half of Howard Catton just before in the screen. Haven't seen you for quite some time, and also to say greetings to you all around the screen, around the world this evening. I am the new president of the World Federation of Public Health Associations as of the 29th of May. So this is technically my first official engagement, so thank you for that. I don't normally write my speeches down, but I have this evening, given that it is, as Jim alluded to, just gone midnight here in New Zealand, body clock all over the place, having just arrived home from Geneva, and the importance of the number of messages that I want to give around the shape of the Federation, the capacity of the Federation, and also our commitment and direction where we're going in line with this work. And I also want to take the lead of Maria in her comments right up front, which were very truthful and honest around, you know, the effect that we're having as humans on our planet. And I think the words were, the world is heating up and it's our fault. So I'm going to tell a little bit of a story, and then I'm going to give you a bit of information about where we're at as the Federation. For those of you that don't know much about the Federation, I invite you to go to the website, wfpha.org, but I have put considerable information through the next part of my talk. Also, the Executive Director, Bettina Borish, will join you for the second half of today's meeting, as I will take my leave at some point to go and get some sleep in the interest of well-being. So, I just also want to acknowledge that here in New Zealand, it's Matariki. This is our new year. We celebrate New Year at this time of the year. It's about aligning ourselves with the stars and the phases of the moon. And when I say ourselves, us as Indigenous peoples here in New Zealand, I am Indigenous, and so everything that I talk about will be flavoured with Indigenous health in mind. So I firstly like to read an email that my mother received after my inauguration as president of the Federation last week. It's from her cousin in Australia. It says, and just for a bit of context, she's a 79-year-old white New Zealander, and he is a 79-year-old white Australian. She was a nurse for 50 years, and he is a climate scientist. So this is the email. Dear Mary, our niece sent me the news of Emma's new position with the WFPHA. My hearty congratulations. I think her generation has more hope than ours of fighting to correct colonial injustices. Her pure white colleagues are more likely to accept that colonisation was morally bankrupt. A neighbour of ours does a lot of work with Aboriginal communities, facing a lot of opposition from those who believe in civilising the savages. In my own area of professional involvement, the science of climate change, acceptance of what needs to be done, is probably in an even worse state than fighting for cultural justice. Even in the face of ever-increasing storms, floods, and bushfires, not even my green friends think twice before flying to Europe for a few days. Few accept that sustainable growth is pure oxymoron. Love, Stuart. I think this email depicts a wonderful set of circumstances that we may advantage ourselves by understanding. Indigenous peoples number close to 500 million of the world's population, all sharing a similar symbiotic relationship with the planet. Indigenous ways of doing and being have forever been inextricably linked to cohabitation and survival with the planet as a source of life and thriving. Values-based Indigenous lens is imperative in all that we create, implement, and/or return to in our practice. As the leader of the WFPHA, an organisation that houses and supports the broader public health community, public health medicine practitioners, policy writers, analysts, advocates, academics, health promotion specialists, bin men, barbers, doulas, rongoa traditional medicine practitioners, epidemiologists, health economists, dentists, researchers, and many more. We are well placed towards the broadest public health application and implementation of efforts to address climate emergency as it relates to all determinants of health. Messaging and education is the key to informing and engaging the public in efforts towards the public's health. Consistency and competency and understanding, but also ability to articulate and translate that the climate and its demise is central to all our health and well-being, is paramount to the success of any resolution, framework, or model of anything. Indigenous populations must be central to the considerations also as traditional knowledge systems and ways of caring for and healing the planet are and have been around since time immemorial, and engaging Indigenous communities to help us all understand best practice is about trust and reciprocity. Indigenous populations are greatly, if not more greatly, affected by climate change and therefore increased inequities in health and life circumstance. Rising waters in the Pacific, higher instances of infectious diseases, food insecurity, and economic instability, to name a few. There is a well-known saying in New Zealand that if we prioritise the health and well-being of Indigenous populations, those most affected by inequity, then we will by default raise the health and well-being of all. I think the reference in the email my mother received to the notion of the continuing idea of civilising the savages is a helpful reminder that not seriously listening to these significantly affected populations, not equipping our decision makers, our public health workforces with substantial understanding about the importance of this focus is in some way a blindfold to that notion. So I would suggest that there are some very key understandings we need to reach in regards to partnership approaches to climate health that authentically ensure our practice and implementation is aligned to best outcomes for those who have and will be most affected, while valuing the gift of the knowledges that have always protected planet and people in the most sustainable ways to benefit all. The WFPHA goals of advocating for peace, promoting sustainable health equity, and developing global policies aimed at enhancing the health of populations and the planet, including a focus now towards systems change and decolonising public health, which is particularly about education and implementation of tools that create change in practice and delivery, that rebalance the distribution of resources and prioritisation to greatly address inequities in the most effective ways in all the contexts of how health is determined and how health and well-being is accessed. This prioritises the planet as the most important factor in human survival: air, water, earth, the ecosystem that simply provides life and home. Policy and mechanisms to embed equitable practices at the very core of society, systems and governments are what I think we are all aiming for. And our public health workforces can be a force of change to advocate and action these changes, because we are all at levels of society working on all areas of the determinants of health all of the time. It is certain that there needs to be coherency and clarity of voice, which takes me back to consistency in education, competency and focused implementation. The WFPHA has over 110 members, over 5 million individual members that, as mentioned earlier, consist of a very diverse workforce at many levels of influence. We have a program of work and strategic plan, ever developing opportunities, which align well with advocating for and implementing actions to support the goals of the WHA 77 resolution on climate change. Currently, several of our very active working groups, environmental, public health professionals, education and training, Indigenous and young WFPHA, as well as others, have been working towards actions and advocacy that are already impacting in this space and are now working on stronger collaborations and alignments with each other and through broader networks. The WFPHA is happy to support and promote through our organisation networks, advocacy and influence in workforce education and public health, the continued work on and towards climate change, climate sustainability, and continuing to influence our workforce and members to adopt best practice for best outcome, public health for all the public's health. He manu kai a te miro nona te ngahere, he manu kai o te rangatira nona te ao. The bird that eats the berries, his is the forest. The bird that eats the food of chiefs, education, knowledge, and conversation, his is the world. So thank you. I appreciate the time and the sharing, and I hope that all of the messages therein will be received. There was a lot, but I really stand with the notion of promoting positive aspects of climate change mitigation and prevention and promotion are key. So thank you very much, Jim, and Maria, back to you. Kia ora.
Thank you very much, Emma, both for the inaugural nature of your engagement as the president of World Federation but also for the lateness of the hour. And we really do appreciate some of the comments you made there and the force for change. You are the epitome of that in terms of this agenda, Emma. Thank you very much. And Professor Bettina Boris is with us, the Executive Director, and will continue as we go through the program. From one side of the world to the other, we're going to turn now to invite Professor Laura Magana, who comes in two capacities. She's the President and Chief Executive Officer of the Association of Schools of Public Health, Programs of Public Health in the United States, and the President of the Global Network of the Academic Public Health. Laura, Professor Magana, the floor is yours.
Thank you so much. Thank you for inviting me. It's my great honor and privilege to be here and just to sharing what the academic public health is doing in this regard. I do have a presentation. It's a short presentation. Would you please allow me? Because I want to share my screen for my presentation. Is that okay?
Yes, tech will do that now.
Thank you.
You can go ahead. There you go. We can see.
Let's see. Still say the host disabled participant screen being shared. I still cannot do it. Let me try it again. No. I am sorry, but I still cannot do it.
I wonder if it's possible.
Apologies, Laura. Tech is trying to look into this IT support.
Thank you.
We seem to be having a technical difficulty.
Thank you. But do you think it will be solved? No, I can understand.
Laura, may I? We seem to have for some reason the tech is being confused. We can give you a couple of minutes, Laura, and then we come back to you to see if we can resolve. And yes,
let's do that because
okay,
it will help.
Yeah,
I think it will help.
Yeah, we'll come back to you in a moment then.
Okay, that's perfect. Yes. Thank you so much.
Thank you, Laura. So, colleagues, ladies and gentlemen, what we'll do then is turn to something hopefully where technology won't be challenging in the room with Howard Catton, who's the Chief Executive of the International Council of Nurses and also representative of the World Health Professions Alliance, bringing together 5 of the key occupational groups representing more than 41 million of health professions around the world, approximately, at any given point. Howard, the floor is yours.
I may be challenged in many ways, Jim, but not technologically today, as I don't have a presentation. Good morning, good afternoon, good evening. My pleasure to be with you all. My name's Howard Catton, as Jim said. I'm a nurse. I'm the Chief Executive Officer of the International Council of Nurses, but I'm here representing the World Health Professions Alliance today. Firstly, many congratulations and thanks to Dr. Maria, to Jim, for organising this opportunity. I think it's incredibly timely, and the brief remarks that I'm going to make, I think, show how this is an issue which is now a high priority for all of the health professional associations. I'm going to share a little bit of the work that we've been doing in this space. The World Health Professional Association is comprised of the World Dental Association, the World Pharmaceutical Association, the World Medical Association, World Physiotherapists, and the International Council of Nurses. When I last totted them up, I know that we say 41 million, but I think it's nearer to 50 million. There are about 29 million nurses, 13 million doctors, 4 million pharmacists, 2.5 million dentists, according to WHO. So around about 48.5 million. The total global health workforce, I think, is about 65 million. So that would be in the region of 75%. If you look on the World Health Professional Alliance website, the Alliance is 25 years old this year. You will find a policy statement on climate change. But you will also find on that website and through links to the websites of all of the organisations who are members, a really wide range of individual policy statements that relate not just to climate change, but to planetary health, to issues of sustainability and mitigation, that speak to advocacy letters and initiatives that all of the organisations have been involved in, signatories to declarations, to letters, to interventions, to events, to congresses, to webinars held by all of the associations in relation to climate change as well, and our membership of some significant other collaborations, most specifically the Global Climate Health Alliance, of which the majority of WHPA members are also members as well. So there's a wealth of literature, of information, of policy work, of advocacy and activism that you'll be able to find there already. I want to share some comments with you in two parts. Firstly, specifically about healthcare professionals, and then secondly, some observations in relation to health systems. Dr. Maria's presentation excellently pointed out everything that will be very, very familiar to all of you in terms of the health impacts of climate change on people and populations, from air quality pollution, heat extremes, and climate-induced events. Healthcare professionals see these impacts every day in their practice. They have a ringside seat to the health emergency, which is evolving in plain sight. And I wanted to, Dr. Maria mentioned NCDs. I wanted to mention NCDs, comorbidities, and mental health in particular, because as well as individual physical health impacts of harm, of health harm, health professionals see the exacerbation caused to those who already have a non-communicable disease or some other comorbidity, a chronic condition that may restrict somebody's ability to go out, their mobility, then exacerbated by an extreme weather event. So not only are they not exercising, but they don't go out and buy perhaps a more balanced diet and fresh food. They don't have the social interaction on the street corner or in the shop. They become isolated at home. They may even then start to turn to alcohol, become depressed and withdrawn. All of these factors are interrelated, and healthcare professionals see their relationship to each other, but also the progression and the impact on somebody's health. And they see the disproportionate impacts on the most vulnerable, on the young, and on the old as well. And the evidence, the impact that healthcare professionals are witnessing, we're seeing as well that it's not just for those health professionals who are working in low income settings. We've seen how this awareness, the concern, and the activism has spread right the way across the world to cover high income settings. The very significant legal case brought by a group of older Swiss women from Switzerland, Swiss women who took the case to the European Human Rights Court. That group of older women included a nurse, Pia, who talks very articulately both about what she saw, what she witnessed in her concerns as a nurse, but also the disproportionate impact as an older woman. And when you hear health professionals talk, they express clearly this sense of how climate change is supercharging existing healthcare needs and demands. Turning then specifically to disasters, the result of extreme weather or climate-induced events. Again, healthcare professionals who see the physical injuries, the trauma, but then the spread of infections, diseases, the impacts of contaminated food, of water, the wipeout of healthcare facilities and infrastructure. Again, the mental health trauma of having everything destroyed and then having to restart again. So the witness that they see is of the evidences of the reality. And those voices are so powerful as well because of an issue that Dr. Maria mentioned, is the trust in which healthcare professionals are held. Dr. Maria's slide had doctors at the top. I think it's a really important slide to have, but I think it needs an amendment because actually the polling that's done puts nurses at the top of pretty much every poll of the most trusted health professional. And if we included pharmacists and dentists and physios as well, I think that you would see that it's as much as I love and work with my medical colleagues, it's not just about the medical community, it's about the entire healthcare workforce. And not forgetting in all of this, that having said that they're witnesses to the emergency that's unfolding, never forgetting this has an impact on them as individuals, on them as people. It's a little bit like with COVID, where the consequences of the world not being prepared for COVID, it wasn't the people who failed to prepare who had to face those, it was healthcare professionals. And that has a very real impact on their health and their well-being. And there is a major issue in terms of building healthcare worker capacity through addressing shortages, building the specialist public health workforce through education and through training as well. But a lot of that seems to be then focused on healthcare professionals as the responders to climate change, to disasters. And I just wanted to make sure that we added in, didn't leave to one side, both the role that healthcare professionals play in prevention and also in recovery as well. Again, we all know that what's good for individuals' health and public health is good for planetary health as well. We know that healthcare professionals are agents for behaviour change because of the trusted relationships they have. We know that they inform, that they educate, but we don't necessarily always involve healthcare professionals in decision making around transport policy, around food policy, around making it as easy as possible for people to make healthy choices rather than just telling them what to do. Similarly with recovery, we all see how quickly health crisis, climate-induced health crisis, results in a humanitarian crisis, the result of collapse of infrastructure rights as well. But how often do we hear that we should have health in all policies? We agree with that. But does that always translate and follow through in terms of needing and having healthcare professionals in all policy making? If we're serious about health in all policies, we have to be as serious about having healthcare professionals in all policy making. So just in relation to healthcare professionals and their practice, the issues that they witness, that they see in their practice, not just regarding them as responders, but having a role in prevention and recovery, and then thinking through what that means in terms of how we position them in relation to leadership and leadership over policy and system designs. And then just a few comments, the second part in relation to health systems response to climate, to climate change. All of the organisations from the World Health Professional Alliance have issued guidance on adaptation and mitigation, waste management being a particular issues. They've produced toolkits, educational materials. There's some very detailed advice from our dentistry and pharmacy colleagues as well in relation to adaptation and mitigation. But there's also a piece around how different and new models of care, more preventative, public health, primary care focused in remote and rural areas, models of care, not traditionally medically orchestrated, organised models of care, are also more sustainable models of care, as well as being the sorts of models of care that we need to look at implementing in order to meet the big global health challenges. We also know that I think I heard just last week that somebody said that the health sector globally was the 5th biggest emitter after the countries, some of the countries that we know about as well. So there's a huge role in terms of reducing emissions of our health systems. But there's an issue within that, just a cautionary note on a lot of that discussion about making our health systems resilient. And I'm not being flippant, but I put it like this: is as an encouragement for people to turn off the lights and to do the recycling. All of those things are important, but that does not mean that healthcare professionals are not going to engage in the big issues for addressing and tackling climate change. Those two I would highlight, as Maria has highlighted. Firstly, a major obstacle is a lack of financing for adaptation and mitigation. I didn't realize it was as low as 0.5%, but that speaks, it's a dreadful figure, but it speaks powerfully for itself. But also not shying away from the root cause being fossil fuels. And the healthcare professions have called very clearly to support the end of the expansion of fossil fuels, a fast-track transition, have questioned whether industry should have any place in climate change negotiations, have been involved in a range of activism, most notably recently a letter that we were party signatures to the COP28 president as well. Absolutely support the Uniting Health for Climate Change initiative with WHO, will support the action plan, supported the resolution, will continue to work through the Climate Global Health Alliance as well. And we can mobilize our professions, not just globally, but nationally and through individual associations as well. And what we see, an awful lot of the associations and individuals who are coming forward to engage in this debate, and these links have been made already, it's broader than climate change. It's about planetary health. It's a discussion about the impact of human behavior generally on the health of the planet. Final point, I'm sort of going to go back to the trust issue, but just to try and highlight what I think is a thread that ties together the comments on healthcare professionals and the comments on healthcare systems that I've made as well. All of the healthcare professionals work to codes of ethics that govern their professional practice every single day. And the bar is set incredibly high in terms of always putting people in healthcare first, respecting and advocating for rights, for justice, for equity, the principles that many of the principles that Emma so powerfully set out as well. And you will see that a lot of those statements on ethical practice now also articulate the importance of reducing environmental practices that are harmful to health, policies that will positively promote health and well-being as well. So the protection, the support, the health of the planet runs deeply through not just the practice, but is embedded within the principles, the ethics, the ethos with which all healthcare professionals approach their work. Thank you, Jim.
Thank you very much, Howard. The voice of almost 50 million, rather than 41, 48 and a half. Really impressive, Howard, just in terms of the different roles there and the different competencies and factors. So, Laura, we're going to go back to Laura. It's not a Zoom meeting unless we talk about technical errors or you unmute yourself. Hopefully now, Laura, we can see your presentation. The floor is yours.
Perfect. Thank you so much. So again, thank you so much for having me representing the global network of academic public health. Very excited about that. And as Maria and yourself really very eloquently said at the very beginning, this requires emergency action and multi-sectorial really action. So here I am representing the academic sector. That's the Education for Public Health, which is our network. So just a little bit of a background that if you're not familiar with our global network, we are representing all the schools and programs of public health around the world through the 7 regional associations that exist in the world, which are listed here. But you can see in this list, there are, all the schools all the way from America to Africa, Latin America, Europe, and so on. So we're all together for here. I'm going to say it right now for one purpose, but before I said that, we are representing more than 450 schools and programs of public health, more than 100 countries in 6 different continents, with one specific goal, is just to enhance the academic public health worldwide through mutual learning and collaboration between academic public health institutions globally in order to improve and protect the health of the people and the planet. And guess what? Since last year, we know and we decided to work in climate change and health as our priority. So we are here very excited to join forces with you and just to share what we have already done in order just to collaborate. And we're very happy and celebrating the resolution that was passed. So very happy to really join this incredible, powerful group from academia. So a few things that I would like to share with you, that things that we're already doing and could be resources. And of course, we are here just to hear the ideas and the work that has to be done, just to join forces with all of you. But we have joined already forces, for example, with the Global Consortium on Climate and Health Education. So they do have a lot of resources already in terms of courses and tools for the universities in order to really be working to acknowledge with the students, with the researchers and the community. So we're working with them. We have done seminars with them, but we also are right now preparing a global course in this area. Some of our associations, of course, are already working in climate change. Right here on the call, my colleagues from ASFER are present and they can really elaborate more in all the strategy, but the European Association of Schools and Programs of Public Health, they are already working in climate change and health, and they can really share more about what they are doing. And as a matter of just an example, I want to bring to the table the work that ASPPH, which is the association in America, the one I'm leading, we have done in this area, because again, climate change and health was also identified in my own association as one of the priorities. So we put together a workforce that for more than a year worked very intensively in putting together a framework. So this is a framework that we have right now that we just published, and the framework has, again, is directed to the schools and programs of public health. It has 4 domains, which you can see in the center, which is education and training, research, policy, advocacy, and practice. And we understand that, of course, there is a multi lenses here, but the most important lenses that we want to really tackle are the justice, the environmental justice, talking about social justice and health equity. Also, we know that we cannot do this alone. We need partnerships for impact. And of course, we need an interdisciplinary and interprofessional approach. You can see in the publications that we have several strategies, because we also understand that this major challenge, it can be tackled not just with one strategy, but we need a multifactorial strategies from the academia. So we go in the document all the way from education to research, to innovation, to communication, to advocacy, to working with our partners. As I was referring, there are 3 cross-cutting themes, which in the document you can find it. It's extremely important for us. We need to recognize that the health inequities really brought about in this area are really amplified by climate change. So we work a lot, and we really recommend continue the advocacy in terms of equitable solutions. Of course, we talk about partners, and that's why we're here, and we're really more than happy to join the forces here with all of you. And we're working more with our other health professionals and beyond the health professionals as well, because we understand we need more interprofessional and interdisciplinary collaborations. So these are the 4 domains, and in the documents you can find some specific recommendations in all of them, in all of these 4 areas. We have principles and recommendations all through all the documents, and you can see there are overarching recommendations for the schools and public schools and programs of public health, but also recommendations for the association and what to do and how can we partner with our all collaborators. Right now, because we finalized already the framework, we are implementing the framework. One of the very first things that we're doing is we're developing competencies, because as Mary was saying, I mean, one of the things that actually like 3 months ago, the Colombia network started to send a survey, and maybe some of you participated in that survey, in order to understand if the schools and programs have already competencies in this area. And actually, the Lancet is going to be in the Lancet article. It's going to be published in the next, I guess, like couple of weeks. But the article is going to tell us, you know, how much more we need to do. Of course, we're working. What are the competencies that all the schools and programs of public health or the public health graduates have to have as the basis? But we also are developing competencies for an area of concentration that a lot of our members and a lot of the schools around the world are doing some areas of concentrations from the MPH. So what are those competencies look like? But also we're trying to work with the other health professionals, because everyone has to have in their competencies of all the graduates, of course, competencies in these areas. So these are the 3 documents that you can see online. One is a complete framework. The second one is an executive summary, and the third one is a toolkit that is a lived document. We're, you know, constantly uploading materials. And I just want to finalize by saying that we're very excited to be part of this group. We are here with all the talent, all the skills, all the willingness to really move forward this urgent, really urgent area. So thank you for the invitation, and representing the whole academic public health. It's an honor. Thank you, Jim.
Thank you very much, Laura. Muchas gracias. It's great to see the role of the schools of public health worldwide and their engagement in this. And key, that the point that you made, there's a lot of ongoing work in different regions, different countries that we can take advantage of. So, ladies and gentlemen, from some of the global organizations, we're going to come down to a national perspective. And it's a pleasure to invite Professor Paul Johnston, who's the chair of the Climate and Health Committee at the Faculty of Public Health in the United Kingdom. Professor Johnston, the floor is yours.
Yeah, thank you very much, Jim. And it's a real pleasure to be invited to speak. I'll just say a few words. First of all, I represent the UK Faculty of Public Health. I'm the chair of the Climate and Health Committee. The faculty is the UK's professional body for public health practitioners, and it sets standards for training, education, practice, and advocacy. By way of background, it has 5,000 members. So in the scale of what we've been talking, we're going to quite a small organization here, but we have of our 5,000 members, 1,000 actually live in other countries. And crucially, although we're small, our members often occupy leadership roles locally in councils, in cities, in regions, in hospitals, in healthcare organizations, nationally and internationally. So we have a potential here for persuading leadership here in the climate and health agenda. So we have one of the, I think the main point I wanted to say was that we have a little strategy for climate and health, which we revised a year ago. And we have engaged with our members, and we've talked through how do we really implement some of the changes that we've been hearing about at a local grassroots level and at all the other levels I mentioned. It's a very simple strategy. It has 3 aims. That's to increase advocacy for awareness raising events, lobbying and consultations, to improve the resources for our workforce through case studies, guides, which is web-based, and getting our own act together so that we are a net zero organization and aim to be a net zero organization. So just quickly, some of the results so far. We have a very vibrant group of members. Certainly over 200 are in what we call a specialist interest group, and we have a very vibrant committee, but we recognize that that is still a fraction of our workforce. We've attended the last 3 COPs, and we've been part of the whole movement for engaging other partners and understanding that the climate crisis is indeed a health crisis. And we've partnered with universities. This is not just to look at the evidence, but also to work on their education programs and curricula so that we can get climate and health in their agendas. We have a tool site which just revised, which has case studies and guides, and we've had some high-profile lectures and an annual program of lectures which helps to share the learning with our membership. And then finally, I'm really pleased to say that we're heading for being a net zero organization. We engaged in an audit with other professional colleagues called a scorecard, where we looked at our organization, we looked at our bank account, our investments, our policies for education, training, conferences and travel. And I'm really pleased to say that we significantly, through that process and through that self-audit, reduced our carbon footprint. We have an ethical investment policy now, which not only prohibits investment in fossil fuels, but actively invests in green policies and in areas to tackle inequalities and poverty. And then we've managed to offset the remaining difference. So technically we are a net zero organization, but having said that, we realize there's still lots of work to do. And through our work with the other professional colleges, we came joint top in our work so far, but recognize there's plenty more to do. So just before I go, I just want to reflect on what that strategy has done for us and how it's made a difference. We think that through dialogue, when we revised the strategy and started the strategy, it was through simple dialogue, simple engagement, communications, consulting on drafts, and making sure that every part of the UK's faculty's work and workforce are involved in the strategy. And we think that I personally think that the audit has been very helpful as well. And I think a self-audit of where you are so that you can measure where you are now and then come up with a shared vision on where you want to go, I think is a really important part to our strategy. Finally, just to say, I really welcome the WHO leadership. I recognize there are still huge challenges, even with our small public health workforce. There's still a fraction of the workforce only get it. It still feels marginal. There's even counter arguments because we're a colder country and more people die from cold weather that people say that it's a good thing, believe it or not. It's a nonsense and it completely misses the big picture and the wider obligations. So there's still plenty to do with our workforce. But we think that this is a really good step by WHO in mainstreaming the climate and health agenda. Thank you.
Thank you very much, Professor Johnson. Paul, really appreciate that as well. And just for colleagues, just to really the emphasis on this, there's lots of ongoing work around the world that's happening. The resolution in the Assembly is a bit of a milestone to reinvigorate some of this work. But the point Paul was making there in that the national programs continuously monitoring, evaluating, looking at audit to therefore improve how the other organizations may adapt and adopt is something that we, as WHO, we're constantly looking to learn from country work. What has worked where, under what circumstances. And so documenting that, making that evidence available will be a real valuable proposition for this global partnership that we're inviting everybody to participate in. Colleagues, we'd also invited the president, the secretariat of the International Association of National Public Health Institutions to make some remarks. Unfortunately, we were short notice because the resolution was only passed last week and the head was unavailable today. But just a brief remarks, we did just ask them just to provide a couple of comments to share with the group. And again, the learning from other associations and other organizations, the key point here. The International Association of National Public Health Institutes, representing member states and groups around the world, INFI, they were integral in terms of COP26 in Glasgow, Scotland, really pushing the boundary. We all recognize the success last year, and now we're looking at how we impact COP29 and COP30 beyond as a group. But they were instrumental in really putting a roadmap and setting out some of the opportunities as institutions from member states to get that further forward. And that really looking at their particular vantage point around their sort of scientific and institutional position within countries to get that done. And comes back to this point about capabilities, the institutions and their capabilities. And what we're particularly looking at is around their work then beyond the COP26, their climate change committee with Sebastian Denis, who leads that group, engaging member states around the world in that action, constantly evaluating, constantly understanding what's happening. And now as they accelerate their work, looking additionally into extreme weather events. This may be a new acronym for some, EWE, extreme weather events. We're living through it here in Geneva yesterday with the hailstorms on the middle of June. Flights cancelled into Geneva airport because of the storms and the conditions. The floods in Brazil, everywhere else that we're witnessing worldwide. And just really understanding that these climate change extreme weather events and how do public health institutions come together to understand that. And we look forward to working with Sebastian Denis, the chair of the committee, colleagues, President Duncan Selby and the Secretariat in the coming process as we develop a work plan around the partnership. So that concludes the first part of the remarks from the organizations and WHO. What we want to go into now is to really engage the personnel that are with us online and the colleagues in the room in terms of the partnership. If you go back to the resolution that was adopted in the Assembly, really requesting Dr. Tedros, the Director General, to ensure that we have a collaboration across the UN bodies, the UN family, and with all relevant partners at national, regional, and multilateral level to advance this agenda. And that's where we want to engage with you all now. It's a pleasure, technology permitting, and I'm looking to my colleagues, technology permitting, we're going to invite Jen Kuhl, who's with the Global Climate and Health Alliance, to help us through this next session where we're going to be using Slido and posing a series of questions for you to give us feedback. And again, let me remind you, the question and answer capacity in Zoom, please post your questions. We'll also be coming back to those as well. Jen, over to you.
Thank you so much, Jim, for that kind introduction. Thank you to the WHO for inviting me to be here. It's a real honor not only to join this remarkable group of speakers and presenters, but also already seeing the remarkable expertise in the room from all over the world. I think it's an honor to be in this conversation. Given that we've been listening for a moment, before we get started, if you're listening at home and even if you're listening in the room, I'm going to invite you to take a moment to shake something out, give like a small stretch as we get our brains engaged in doing something together. So yeah, just take 1 moment to kind of shake yourself out and wake yourself up, be it that you're up in the very early morning or staying up late as our first speaker was, and then we're going to get into it. So today for engagement, we're going to use something called Slido. I'm just going to share my screen. All right, so you should be able to see my screen. I will also, you should be able to see the Slido window. I'm also going to drop the link for this Slido in the chat in case it doesn't work for you to scan the QR code. And once you get into it, probably you won't see a poll yet. You'll just see this same invitation to get started. So here is the link in case the QR code is not working for you. All right. So let's get started. We're gonna do a quick warm-up round. I would just love to know who's in the room. So let us know. We've got a sense of where you are in the world, but would love to hear, are you a nurse? Are you a dentist? Are you a doctor? A real range. Nurses, students, health promoters, advocates. Love to see public health coming up a lot. Oh, occupational therapist. So some allied health as well. Great to see many students joining us and nutritionists. It's, and again, very exciting to see the range from across the whole spectrum of health workers. So thank you very much for joining us. We'll give another moment for a final few people to engage, and then we'll move on to the meatier questions after this warm up. Okay, so we're now going to move into a section of Slido called ideas. And the reason I wanted to do this is because the interesting thing about the ideas option is it lets you to submit an answer, but it also allows you to upvote an answer. And so I thought that in a scenario where somebody might give an answer that is something you agree with or something that you thought of, you can like it essentially and move it up the list rather than having, there's 100 of us on the call. So rather than having 15 people write the same thing, if you see somebody who said the thing you agree with, you can like it and vote in a way, as well as entering your own answers. So in the participant view, what I believe should happen is you should be able to see a toggle. So there's one that was questions, and then you should be able to see a toggle that says ideas. And that should allow you to start to answer this question under the ideas section. So we've heard a lot about the role that health professionals and their representative associations, councils, institutions, and schools can play. We've seen some of that leadership from institutional leaders who are joining us, but would love to hear from you. In your view, this answer can be, I think, up to 100 or 200 characters, so you can write a bit of a sentence if you want. But would love to hear from you what role you think both health professionals and the various institutions they engage with can play. And I'm going to put on a minute and a half of writing music so that if you're a person who writes better when somebody's not talking at you, you can do that. And then we'll take a few comments after people have had a chance to give some input.
Nothing crazy.
Oh, interesting. Seeing lots of great answers here. And education and education of the public. Leadership is certainly rising to the top. Education of the public, as well as peers, I think, is rising to the top. Lots of folks who are saying a role for health professionals and representative organizations and advocacy, speaking together, building capacity. I wish there was a way Slido would let me like sort the way that you could sort if you were in person, but we'll have to go with the voting to allow that to happen. I'm going to turn it over to folks in the room or on the floor. We're going to take this. We're going to take just about 5 minutes if anybody wants to make a verbal comment. You're also welcome to keep writing, and maybe I'll turn to folks who are physically in the room. If there's anybody who's in physically in the space that Jim and the rest of the folks are in, and anybody who's in the room would like to make a comment, we'll go to that first, and then I might be able to take 1 or 2 comments from the online space. Any just reflections on what you're seeing?
Yeah, thank you very much. I have seen a lot of role models, educators. Well, my name is Professor Bettina Borisch. I am the CEO of the World Federation of Public Health Associations. And I thank Jim and the organizing team here of having me, and also our president, Emma, to have the opening remarks. Now that I look at the results from the Slido, I have some remarks of the fact that I see a lot of awareness, leadership, change. I think that leads to the fact that we all know we are running in the wrong direction. We all know that we have not only to change, but to make a turn of 180 degrees even. And to do so, we need political work. Also in the first Slido, I looked at who are the people answering, but I didn't see any politician. I think when we say health is our business, is all our business, is public's health, then we need the political work and the political world in it to get the change. As already said, Yamfi is working with situations like COP. We are going to G7, G20, but I think it comes down to local policies and politicians as well. If we want to get the changes that are necessary, we need not only the healthy workforce be aware and be a good role model, but I think to be involved with all and everyone, including politicians. We have to have this on our agenda, and we have, as we do in public health, as the Public Health Association does, to work to architects, urbanists, to people who are, as well as we, leading to health. And we should be, I think we can be, the link. I don't want to say the missing link, but the link between all the silos, between the silos of that, those who work for healthy cities and those who work for healthy buildings and those who work for a safe world, like we are talking to policemen as well. We should be this link, and I think that the people that are here on the Slido know it very well. And especially old medical doctors said, why do I treat people to send them back in the conditions that made them sick in the very beginning? So our work and our finest task is what is mentioned here, the advocacy, the lobbying, but also to go very boldly to the political level and name and perhaps shame those who go in the wrong direction. And I think this is a bit what I would like to see here, not only policies, health and all policies and so forth, but the real political work. The famous Rudolf Virchow, a pathologist and then public health specialist, did it himself. He became a member of the Prussian parliament and got quite angry with the Prussian king at that time. But he was in favor of sanitation, clean water, clean air. He worked for it and he knew clean water, clean air is political work. If we make health our all business, then it's political work in the finest sense. Polis, like the political group of a person or a state or a city. Thank you.
Thank you very
Thank
much,
you.
Betty. Jen, back to you for the next question.
Thanks so much. All right, so we're going to move on. Same setup. You can add your answers and also upvote others' answers. So this one looks at, given that incredible multitude of roles health workers can play, what actions and enablers, including capacity needs, are needed to empower the voice of health professionals and their representative associations, councils, institutions, and schools in protecting human health and its associated determinants? And again, we're going to take about a minute and a half, 2 minutes, where people can write, and then we'll take another comment. Seeing quite a range of answers. There's an entertaining reflection where somebody, perhaps somewhat formally, has put financial resources and shorter down. Somebody has just put money with many letters, which I think really resonates and is something we saw reflected in the calls earlier made by the panel, that we need health institutions, health professionals to be resourced to adapt to a changing world. Also seeing many folks who are noting the need for training and capacity building so that the workforce can be empowered to meet this challenge. And again, you're welcome to keep upvoting, to keep adding answers. I think what we'll aim to do is process the results of these surveys a little bit and include them in any report out from this consultation. So do please continue to add your answers. But again, I know there are some folks in the room who have been thoughtfully prepared to respond to the results that we're seeing. So I'll turn it back to the room momentarily.
Jen, just for the moment, I wonder if we've got somebody online from a small island developing state, from
We do
a low and
actually.
middle income country.
Yes, I can see that James Hospitalis, who I believe is based in Trinidad and Tobago, which is a small island state threatened by climate change, has his hand raised. So James, maybe we'll turn to you.
Thank you, Jen, and thanks, Jim. I'm really happy WHO is having this meeting. You know, health is late to the dance because the Paris Agreement on climate change mentions health. Do you know how many times? Once in the preamble. So if this is the biggest global public health problem, we are kind of late to the dance. But health is going to be super important. Governments and businesses are failing us. They are. And the fact that we have COPs with oil company presidents, oil company owners as the chair of the thing is just shouldn't be. It's like putting a tobacco baron in charge of tobacco control talks, or an arms dealer in charge of arms control talks. The health profession should advocate against that. Big tobacco, big alcohol, big oil, they're all using the same tactics and the same common playbook to lie, deny, deflect, delay. I should have said I'm a health professional. I'm a public health doc. I'm from Trinidad and Tobago, and I'm grounded in the small islands. I've worked in the WHO system. I was the head of the Caribbean Public Health Agency. So I've seen what climate's doing to us. I've been alive for 2 climate timescales. Climate timescale is 30 years, if you didn't know. And largely, doctors and nurses are still sleepwalking where climate change and planetary health are concerned. They've heard about it, but they have less idea of specifically what the impacts are on health and what they could do. So I don't want to take up too much time. One of the things I do want to encourage, we do a lot of training. We work with Global Consortium on Climate and Health. We're on the board of GCHA. We do research. One of the things I do want to flag and encourage is the leadership that's coming from small island states on taking climate change to the international courts. The law has always been a powerful instrument of public health, and really need to look at the International Tribunal and the Law of the Sea, the verdict that came out 2 weeks ago that deemed carbon dioxide as a pollutant and therefore subject to a lot of other laws. The International Court of Justice advisory opinion on the obligations of states towards SIDS where climate is concerned. That's another powerful movement. And the health argument can add a lot of strength to the statements that member states are coming with to put into the ICJ. The Inter-American Court on Human Rights, which met a few weeks ago in Barbados on climate change and the problems associated. So I want to flag that in closing my remarks. Thank you, Jen. Great meeting. I'd love to be part of this partnership.
Thank you so much, James.
Thank you very much, James. Jen, let's have one more question and another round of, see if we can get somebody from the student body to then the next round as well. Thank you.
That sounds great. Thanks. All right. So this next question turns more directly to health systems and health facilities. So you can answer this question in whatever way you choose. So how can health professionals and their representative associations, councils, institutions, and schools accelerate progress on resilient low carbon health systems? Or if you'd prefer to do a more targeted answer, to the sustainable health facilities in your countries. So what's the role that health professionals and associations can play in building resilient and also low carbon health systems that respond to the climate crisis? Or if you want to focus more on health facilities, we'd also welcome those answers. And again, I'm going to give about 2 minutes of writing and then we'll have reflections. interesting to see this time around. We've got some really thorough answers that are robust. So vulnerability assessments to guide policy development. Yeah, lots of calls for those vulnerability assessments, so we know what we're dealing with and what responses are needed. Starting with schools, it's really helpful and I think rich learning for all of us to see the depth and the length of some of these answers. It's clearly something folks on the call have been thinking about. Jim had asked if there might be a medical student. I saw pharmacy students, possibly nursing students on that first Slido. Is there somebody, given that this question also includes schools and education, education being a major feature in preparing the health workforce to respond to a climate change future. Is there a student who might want to make a comment?
Hello, I don't know whether there's anyone else, but I'm here. I'm Kirigo Ashira from Kenya, and my contribution is on the vulnerability and adaptation assessments to guide on policy implementation and development, which will then guide us on the HNAPs. That would be a perfect way to go through climate resilience. Then on the low carbons, we need to use toolkits available to calculate the emissions based on the scopes, that is scope 1, 2, and 3. That will then guide us on developing the necessary action plans towards the net zero emission target. Thank you.
Thank you so much for stepping up. That was a wonderful intervention and much appreciated.
Jen, thank you very much for that, and great to see the student perspective from Kenya being brought in there. Given the question was particularly around the role of health professions in low carbon systems, Howard, any final thoughts briefly?
Just a couple of thanks, Jim, and thanks everyone. That was very, very rich. A couple of quick thoughts. There's clearly a really strong theme in relation to advocacy, providing information, education, the fact that we're trusted communicators. I don't think that we're necessarily doing that consistently enough on a consensus basis. I think that there's clearly more that we can do to be organised in how we are communicating as healthcare professionals. And there's some simple stuff there's been some really powerful stories that have popped up today in the chat, and I hear them a lot about the impact of climate change, not just on health, but then all of those other consequences on food, on agriculture, on transport, the other humanitarian pieces. I think we need to, again, we could do better with the communication piece in terms of collating some of those really powerful stories. And then I said something which somebody reacted to in the chat about helping people to make healthy choices, and somebody was asking about that, and it was about making the healthy choice the easy choice. So I don't know about everybody else, but if somebody tells me that, you know, the diet I need to eat involves getting the latest superfoods and I've got to go and scour the supermarket for mung beans and matcha, it ain't going to happen. Put the recipe with the green vegetables that I need to make that easy and make that simple formally. Similarly with transport, I would, you know, just the other day, so was looking at getting to Frankfurt, and it's actually from here, you know, it's 5 or 6 hours. But then when you check out the cost, that's not great either. The reason I make those two examples is that because I think it does take us also in a place where we have to be prepared to think about tax and advertising and regulation issues as well. And that might not be the starting point with all healthcare professionals, but healthcare professionals also have a voice in those areas, which goes back to the final point which I was really pleased to see come through, the leadership piece. And it's the leadership not just for practice, but also for policy as well.
Thank you very much, Howard. So that concludes this session on Slido. What we're going to do is make sure all your answers are captured. We'll try to get a bit of a synthesis of some of the suggestions and everything else. But we're going to come back now to the resolution on climate change and health and the next steps. Member states have given a clear instruction in terms of what needs to be taken forward. And we're going to hit, Marina is just going to have a few minutes now just to take us through some of the opportunities and next steps. Marina, the floor is yours.
Yeah, thank you, Jim. No, this was a really incredible, rich conversation, but and a starting point to really have the healthcare professional and the climate and communities talking to each other, understanding how we can mutually support this big agenda. And this short intervention is only to announce that for us, this is the first starting point of meeting and start consulting and speaking. We would love to continue this relationship by organizing more in-depth conversation and consultation on some of the critical issues that you heard were mentioned during the intervention of our speaker today. Maybe starting from the last, because Jim just mentioned, as you heard, we have adopted just last week at the WHA this important resolution, climate change and health. And most of you that you have followed the WHA, you are familiar with the fact that probably that the next step for this resolution is the development of a global plan of action for implementing this important resolution. And this has been mandated to the WHO, to the WHO Secretariat to organize, but we really wanted to do it in close consultation with healthcare workforce, the health professional, and the whole broader health community that is engaged in this important fight against climate change. So we love one of the in-focus conversations with all of you to really be focused on how we build together this global plan of action. And then going up on the first, the other topics that we mentioned and Maria emphasized in her presentation, we do have a super powerful alliance called ATTACH, Alliance for Transformative Action on Climate Change and Health. This, as you heard, is bringing together Ministry of Health and key health partners that have committed to invest on building climate resilient healthcare and low carbon healthcare. And we love really to have an open conversation with you to understand how there could be an active role of healthcare professionals in supporting or in engaging in working together to make sure these commitments are taken seriously at national level, and then the health workforce can be seen as a key critical actors to support ministries of health to achieve these important commitments. So and then you heard also that we are organizing the second global conference on air pollution and health as well. There we love to really make sure the program that is under development for this important conference take into account also all your ideas, suggestions, and critical views on what should be really the most important emphasis and focus for the conference. And then something that we didn't speak much probably in this conversation, but then we are also preparing for another COP, COP29, and COP for the people that are not familiar. I think most of you are aware of this important big gathering at the end of the year where Ministry of Environment are meeting to advance on reducing carbon emission, taking commitments at national level. And you know, the health community is becoming pretty vocal and very present in this gathering. And we are lucky to have the upcoming presidency very much interested to keep climate health as a sort of a key focus area of discussion for key action. And then you will hear more from us in this consultation, ad hoc consultation we love to do with you. They are speaking about investing in human capital being the key entry point to raise the voice of the health community. And I think who better than health workforces can speak about human capital. So we really love you to share whatever we are cooking up, developing to be presented at COP29 to be consulted with you. And in particular, also we are committed as a World Health Organization to bring together all our knowledge, experience, and key recommendation into a special report on climate change and health, which will title The Health Argument for Climate Action. And we really would love, again, you to be part of all this by inputting with your idea and views. So these are the key topics. We are super open to hear from you as well if there is anything else you think it will deserve an in-depth conversation with us. And then we will announce the date soon and we'll continue. So just again to reemphasize, this is just the first of a long series of consultation we love to maintain with all of you. And I stop here. Back to you, Jim.
Thank you very much, Marina. Really appreciate it. Indeed, just to re-echo that, this is the first of many consultations. The resolution calls for a global plan of action engagement coming through to the COP29 and COP30 accordingly. And the member states have given this mandate to Dr. Tedros. And let me then invite Dr. Tedros's special envoy on climate change and health, Dr. Vanessa Carey, who is going to be part and parcel of ensuring our outreach to the professions, to all relevant stakeholders, to students, is fully integrated. Dr. Vanessa Carey is also the Chief Executive Officer of SEED Global Health and knows the space very well in terms of the role of the health professions in making change at the national level. Dr. Carey, the floor is yours.
Thank you very much for this really engaged discussion. I've joined this morning to listen to a lot of the different inputs, and I want to start by thanking the WHO for taking a very strong leadership position on this. Both Jim, the work you've been doing on the emergency public health workforce, and all the workforce advocacy and really metrics and tools, and also the climate change and health department and their extraordinary partnership for bringing these two agendas together. You know, I speak as a physician who both has served on, you know, in multiple different aspects of caring for patients, have seen what happens when you have a patient come in with a, you know, in asthma, you know, in a full-blown asthma attack, unable to breathe, with no resources available, being triggered by what's happening in the environment in the city. I've served on the front lines of what's happened with COVID. I've seen in the work that we do at SEED Global Health what it means to see changing environments impact entire communities, and how that makes our work harder as healthcare professionals. Our work is getting harder every day. And it's happening at a rate that is extraordinarily quick, and we need to adapt, and we need to build our resilience as well as we need to mitigate. Now, the good news is there's a lot of opportunities that are on the table right now. I'm very grateful to Marina for highlighting the opportunity that we have coming up at COP29. We just had an extraordinary moment at COP28 where we had the first ever day of health that really highlighted the deep, deep interconnectedness between climate change and our human health. Because our health and how it is being affected by climate change is really the lived experience of what is happening. And so, and how we are feeling this, and how we cannot go to work and we cannot care for our families. And there's a deep need for the healthcare community to raise the alarm and to raise the flag and to really highlight the opportunity ahead, not only the dangers that we're facing with climate change, but the opportunity to do something differently, to do something better. And there's a series of opportunities that can happen. I think, one, we do need to get educated to understand all the ways that climate change is impacting our human health, as well as the tools that are available for us as healthcare providers and for our patients to be able to respond, to build that adaptation and resilience, and to be able to meaningfully start to protect our health and protect our communities from the impacts of climate change. We do need to get educated on how do we advocate accurately and with efficacy to leadership, to policymakers, to those that are in a position to create the change that we need. And that is a different skill set than what it means to care for a patient at a bedside. But understanding that skill set allows us to unharness what we are bearing witness to every day. It allows us to take the stories and these incredible experiences that you've outlined and are living all the time and make it real for those that don't understand the danger that we are in if we don't address this intersection of climate change and health. And I think that along those lines, not only can we start to advocate for the way that we as healthcare workers need to be protected and how our jobs are getting harder and how there need to be investments in protecting the healthcare workforce across all the different cadres, building out this emergency public health workforce that we need to respond to this moment, but the ways also that we can really harness the workforce to have the health workforce to have profound impacts on improving patient outcomes, which has a spillover effect of improving our communities, strengthening our families, building economic growth, and promoting a whole cascade of wellness, well-being, and security. It's worth noting that healthcare institutions, healthcare associations, and all of you have a really strong power when we collectively organize and really take forward our collective voice and experience. It becomes a lot more powerful, and I think that there is a very, very strong ability to have influence on what is happening. There's multiple periods throughout history where healthcare workers and the healthcare workforce have been able to influence what policy looks like when we come together and we create our collective voice and we bring forward the powerful narratives of what we see, and we have clarity on what it is that we want to see change. And I think that is the strength of this moment that we can bring forth. It's worth noting, and Marina alluded to this, that we just came off that COP28 as mentioned, but COP29 is going to be about human capital. And that is health, because at the end of the day, the healthcare workforce is the leading edge of strong health systems. We are the ones who are on the front lines of pandemic preparedness and response and surveillance. We are on the front lines of responding to the changing burdens from climate change. We're on the front lines of saving a mother's life when she is hemorrhaging, or dealing with primary care, or caring for the surgical emergencies that are happening, or screening for the mental health burdens. It all comes down to our human ability to interact with our patients and to interact with the communities and protect them. And so while I don't love the word capital because it commoditizes us in a sense, the power of the human in our lived experience every day is what we're really fighting for in climate change. It's what we're fighting for our health, and it's where the opportunity lies for this workforce, us, to champion a whole new set of principles of how we can go forward. And we do need to demand a different set of investments and a different set of leadership. And we have that capability if we lean on evidence, we draw on the tool sets that exist, and we help to build them out further. We build in dynamic systems of benchmarking and understanding and collecting data in real time in ways that we can inform. And we really highlight very critically that health is not just about health, but it has massive multi-sectoral implications, whether it is agriculture and malnutrition, or energy, or economic growth, or our security, or migration. If we can tell those stories and make those connections, then it becomes inevitable and necessary and irrefutable that we have to invest in the power of the health workforce and strong health systems to rise to this moment. So it's my pleasure to be in service to the WHO, to this mandate, to all of you, to think about how we can really transform what our world looks like from today on. And so thank you very much for letting me join you in this critically important conversation.
Thank you very much, Dr. Kerry, the Special Envoy for Climate Change and Health for Dr. Tedros, our Director General. Ladies and gentlemen, that concludes today's session. But just again, it is only the start. Thank you very much to all the associations, institutions, schools, the speakers, the participants from around the world. We look forward to working with you in this next stage of the consultation. Through your registration, we will be reaching out to each and every one of you to engage you in this process, to really come together, as Dr. Kerry just said, in service, working together to make sure that we put people, population, and planet together. Thank you. Have a wonderful day. Goodbye.